And we're live. Hi to all of our viewers. Thank you so much for joining us. My name is Nama. I'm a clinical manager here at ALMA, and we're live again from our headquarters.
Hello, everybody. My name is Sharon. I'm a global clinical training manager here at ALMA. And we are both very excited today to present a topic which I think we've all been waiting for, and that is how to get the most out of your Harmony. So the Harmony has many applicators, each one with its own technology, and we often get asked, can we combine? Can we combine treatments? Can we combine applicators? And today we're going to shed light on this subject, and we're really going to show you how to maximize the full potential of your Harmony platform.
I agree. I think it's a question that we get asked so often, how to combine, what applicators to use. And I think the key to it, one of the main factors is knowing what is each applicator's mechanism of action. And once you know that, you know better how to combine.
Exactly. So I'm sure many of you are familiar with some kind of common known combinations that we've published and that have been quite well established over the past few years. However, there are also some other combinations and other combos which maybe you're less familiar with. And today we're going to show you those. So a few months ago, we held a competition where we asked you guys, the users, the experienced users from your clinics, to send us your best protocol, your best combination, your most creative protocol, and send us your before and after photos. First of all, the response was amazing, and the results were wow.
I agree. And I think this is a good opportunity to say thank you to all of our viewers and all of our users, loyal users, who sent in such amazing pictures. We learned so much from it, and it was all just too good not to share with you, because I really think we can all benefit from learning. As you said, some of the combinations were quite well known, but there were some really unique
real
ones.
Surprises, yeah.
And as you said, the results were absolutely amazing.
Exactly.
So I think this is a really good opportunity to share.
To share with you. Okay, so for those of you that have just joined us, we are talking about Harmony combinations, and we are going to start with the well-known, and for a very good reason, the Clear Lift and Clear Skin. So here we have two different lasers, both at a very different wavelength. Nama will go into describe that in a little more detail. And both work quite differently in the skin tissue. So there's a different mechanism of action there, but together they really complement each other. And for, as you can see here on the screen, for a wide array of
Yeah, and if we just touch on the mechanism of action here, the Clear Lift on the one hand is a Q-switch laser, as we all know, and it basically, what it does is it has a photoacoustic effect. So if we use the 5x5 pixel tip with the unique depth control that we have, we can create tiny little microscopic wounds within the dermis and the epidermis. That then promotes the wound healing cycle and then promotes neocollagenesis. That's the Clear Lift. On the other hand, we have the Clear Skin. Now, the Clear Skin is a different mechanism of action. What it does is it works by water absorption, and it creates the coagulation columns within the dermis, which then also promote the wound healing cycle and process, and also lead to neocollagenesis. So different mechanisms of actions, but when you use them together, you get the ultimate synergistic effect from both of them.
Exactly. And you can see here on the screen, we've got a nice example of a histology taken just to show that coagulation column.
Difference, right.
And it's fairly deep now. I mean, it really kind of has that deep dermal heating. Sure. Okay, so let's look at some before and after pictures. So our first example is how to use this combination for actually a very, very common indication, and that is, of course, active acne. I'm sure most of your clinics see numerous patients with this. Not easy, many options available on the market, but not all of them very accessible, and kind of each one has its disadvantage. But here you can see just after 2 treatments with this combination, so the Clear Skin, a well-established applicator for treating active acne lesions, together though with the Clear Lift, which treats that the redness, the inflammation, and you can see already a vast improvement.
Amazing. I think these results really show how these two applicators complement each other, where the one treats more of the active acne, whilst the other one treats the toning and can prevent the scarring. I think this is a really good option. And as you said, it's an easy combination to do with relatively little to no downtime.
And for teenagers, that's important as well. Okay, so unfortunately, kind of grow out of puberty and we finish with our acne, many of us are left with scars, acne scars, and these are here to stay. So there are options out there on the market, but some of them can be quite harsh. So for example, chemical peels or CO2 treatments. There's always an association with some risks, some adverse events, and there's downtime. You know, very often patients need to be at home for a few weeks. But with this combination, Clear Lift, Clear Skin, you can see here that after maybe several more treatments, you can really get an improvement in the scars, in the texture, because of that dermal remodeling, because of the photoacoustic effect. All this will influence the elastin, the collagen, the actual, the tissue, the deep tissue, and that helps with scars. I mean, you can see.
I think this is a really great case to show where you can see that the depressions here, the scarring here is quite bad. And we all know that this is such a hard indication to deal with because it can really affect a person's self-confidence. So depending on the type of scarring that you have will depend on how many treatments you need. In this case, you can see 5 treatments to achieve this result. You may need more, you may need less, depending on your patient and the type of scarring. But either way, the results, I mean, they speak for themselves.
Exactly. A great option, I think, for scars. Okay, so let's look at one more example from this combination, something slightly different, but very common and very difficult to treat, and that is the aging neck. So as we get older, there's laxity in the skin, fine lines and wrinkles, and especially the neck. Like I said, there's laxity there, and as we age, it gets worse. But here you can see a fantastic result in just 2 treatments of this combination, a pleasant treatment. It's a warming treatment. There's no downtime. It's something that the patient can come back several times to kind of keep it up. But wow, I mean, the tightening here is fantastic.
And I think we so often get asked the question, what can I do with my sagging neck?
Yeah.
So I think this is a really good option to use this combination. So yeah, as we mentioned, that's one of our most common combinations. I'm sure most of our viewers know and use this. Another quite common combination would be to use one of our IPLs. So either the DiVL or DiSR, and to combine this with the Clear Lift, which we just discussed in this past session, the past combination. So to do a combination between the two.
Exactly. So now I might describe to you the mechanism of action, how Clear Lift works, but let's just remind ourselves of DiVL and DiSR. So these are IPLs, meaning that they're not lasers, they are a spectrum of light, intense pulse light, and they cover a small spectrum, but a spectrum where the absorbance by melanin and vascular and hemoglobin is very high. And this treats pigmentations and vascular lesions amazingly. Very popular as a standalone treatment, stationary method, or moving around the face for a more gentle treatment. But if you pair this up with this deep Clear Lift, then you really get a synergistic effect here.
I agree. And I think a really great indication to treat with this combination would be pigmentation. For example, there's so many different types of pigmentation. You've got superficial, you've got deep, you've got multi-layered. And usually when patients come in for treatments, they have different types. It's usually not just one type. For example, in this case, you can see quite different. You can see melasma, you can see deep, you can see sun damage, quite a wide range. And so ideally, this would be a really good option because, as you said, the DiVL will treat the more superficial pigmentation, and the deeper pigmentation can be treated by the Clear Lift.
Exactly, and I'd just like to add there, Nama, that there are different wavelengths here. We're talking about, just to remind you, the Clear Lift is 1064, so it's kind of very deep penetration, whereas the DiVL, although it's more superficial penetration, we're talking about 500, 600 nanometers, so we've got a different absorption curve. Right. If you remember your curves of chromophores and what absorbs what, we're kind of getting it from all angles. So I think that's fantastic. And as we know, all of you know out there, that melasma is a very difficult indication to treat.
It's so common.
So common, many multifactorial condition, and here this is really impressive.
Yeah, great, really great improvement. Another type of pigmentation that we can see here is mixed pigmentation between sun damage or melanin and vascular, like we can see in this picture, which is also ideal because, as you mentioned, the absorption curve of the IPL has strong absorption of both melanin and hemoglobin. Yeah. So ideally, you can treat both using this combination.
Exactly. I mean, especially for rosacea as well, and even
Right.
open pores. All this kind of heating and the DIVLs really do treat that well. And here you can see, as the name suggests, clear lift. There's lifting, there's tightening.
Amazing
there in this
lifting
patient.
here, like an add-on to treating pigmentation.
Exactly.
Let's look at one more example of this combination, and this is, as you can see, more vascular. You can see a lot of vascular pigment here, both on the face and on the neck. And as we just mentioned, there's strong absorption of melanin and hemoglobin with the IPL, so it's a really great treatment, a really great option to treat. And after 3 treatments, you can see it's almost completely disappeared. I mean, it's amazing.
Fantastic, fantastic results, tackling all those indications, all those problem areas, but in one treatment. Great.
Yeah. So there's another option that we can do using the DIVL or DISR, but with a clear skin.
Okay.
But unfortunately, we don't have time to go into that, but we will be releasing a clinical presentation with all of the combinations that we're discussing here and other combinations that we don't have time to discuss, unfortunately. And there'll also be all the protocols, because I'm sure a lot of people are going to ask.
I'm sure they're sitting at home now thinking, what's the protocol? What's the protocol?
So
what
worry.
fluids do I use? But don't worry, that is coming.
Don't worry, it's all coming out. You'll have it all at your use. But let's move on to a different applicator. The AirBeamYag. Now, the AirBeamYag is one of my favorites. It's a different type of treatment. Yeah, and I think we can combine it with a lot of different applicators.
Okay, so let's little reminder about the ALMA. The ALMA is at a wavelength of 2940 nanometers, meaning it has very high absorbance in water. This means that when it hits the skin tissue, there will be evaporation, or we call it ablation. And if we use that in a fractional manner, then we hit the healthy tissue in between these columns of ablation, and that helps for a quicker recovery. But we're also getting that superficial surface resurfacing, which is fantastic.
Yes, exactly. And I think if we use this to combine with the clear skin, which is a deeper treatment, as we mentioned, because of the coagulation columns, they can really complement each other, both on the superficial level with the AirBeamYag and the deeper level using the clear skin. And so often we get asked the question whenever we discuss combinations, what applicator should we do first?
Exactly.
What would you recommend? Specifically in this case, we would recommend starting with a clear skin because it does treat deeper within the dermis, and then using the AirBeamYag to do the more superficial layers of the skin. I would advise, though, in between treatments, applicators give the skin a bit of time to cool down, 15, 20 minutes. I think a good option is either, just give it time, or to speed up the process, you can use ice packs as well, just to give the epidermis time to cool down, and then move on to the AirBeamYag. That would be my advice when talking about these treatments.
Okay, so let's look at some pictures from this combination. So let's go back to that common indication, acne. Active acne, and in this case it's fantastic. I mean, they've used the clear skin, again, well established technology for lesions to dry out those sebaceous glands, to help with the bacteria, with the inflammation, but then ALMA for scars underneath, for peeling, for removing that very superficial layer of skin. And I think this is fantastic.
It's fantastic. And just to mention here, one of the first treatments, the first picture that we discussed was also active acne, where the treatment that was used was clear skin and clear lift. So it just shows you, depending on your toolbox, on what you have available to you, on what your patient wants in terms of downtime, in terms of number of treatment, you can treat the same indication with different combinations and achieve amazing results. So you really do have a wide range here.
Exactly.
To work
so there's
with.
no one right answer of what combination to use. As Nama said, you've got your toolbox, and if you're mindful of what you're picking up when you connect your applicator, then you'll know what to combine as well.
Right.
Do we have one more example?
Yeah, we've got another one of acne scars. So another common indication.
Okay, so this is fantastic. So this is the clear skin with the ALMA. Again, clear skin. This is for scars and redness and just resurfacing and texture. And I mean, this is a fantastic result.
And I think it's important here to mention that this is from a doctor in Indonesia that sent this amazing picture in. And usually when we discuss acne scars or these type of indications, the go-to is to go for more of an ablative treatment, which is often CO2 or other types of lasers. which can be quite tricky for the darker skin types. And here, the erbium YAG is a really good option. It's a really good option to use for the darker skin types because there's less thermal heat.
Exactly. So as Nama said, because the erbium YAG does generate less coagulation, less thermal effect inside the skin tissue, it's probably a better option for darker skin types.
I agree. I think we have one more picture here also of acne scars. As you can see.
Again, a dark skin type.
Dark skin type, 4 treatments. Incredible improvement.
Exactly. And I just want to mention that the clear skin really does help with that dermal remodeling. I mean, we're not talking about, traumatic scars here or other kind of scars or surgical scars, but it is an option as well.
Exactly.
Again, that's another thing we can maybe discuss at the end. But, even for scars that are red, you've got the DIVL, you've got the Q-switch, and then you've got that erbium glass, as you say, for that dermal remodeling of scar tissue.
For sure. I agree. Let's move on to another interesting combination that I personally learned a lot from, which is the erbium YAG and the clear lift. Now, we discussed both mechanisms of action, so this is another great option for fractional ablation and fractional non-ablation. Good option as a combination. And as we discussed earlier with the clear skin and erbium YAG, we usually advise to start with a deeper treatment. So here it would be the clear lift. To start with the clear lift, and then move on to the erbium YAG. But in some cases, and this is really interesting, and I know you've read up a lot about this, you can do the opposite, and you can use the erbium YAG as more of a priming treatment, and then use the clear lift. So, for example, in this case, for tattoos, we looked at this. I mean, first of all, we were blown away by this result.
Is a fantastic
because
result.
It's a quite a big tattoo. It's on the neck. There's color in it,
And it's gone.
and it's gone. And
Yeah.
when we looked it up, they said that the protocol said it was first using the erbium YAG and then using the clear lift.
Exactly. So as Nama said, there's been a lot of talk at conferences, publications of priming tattoos, difficult tattoos to treat. So color tattoos, maybe difficult parts on the body. So priming them with a kind of fractional ablative treatment. And if you guys have it on your Harmony, why not use it? So a couple of passes, or with the erbium YAG, or even with the clear lift plus two would also
option.
create those channels to help with clearance of the tattoo. And again, same session, you go straight in with your focus Q switch to remove the tattoo. And this is one of my favorites.
Yeah.
I think this is a fantastic result.
Amazing. I really think it's a really good example of this combination, using it differently to what we'd usually think. We have one other example of using this for tattoos. This is for a traumatic tattoo. Now, traumatic tattoos are unfortunately due to some sort of trauma where some sort of foreign body becomes embedded within the skin. And then usually what you have is both the pigment from the tattoo, like you can see in this case, and some sort of scar or groove. And this combination is ideal because you've got the clear lift to treat the pigment of the tattoo, and then the erbium YAG to treat the groove or the scarring or the whatever caused the trauma or whatever caused the pigment to be embedded within the skin. So here you can see that the clear lift was used for the pigment and the erbium YAG for the resurfacing. And I mean,
exactly. I mean, if you don't have a CO2 and you want to kind of build up that like you said, scar tissue, use an erbium YAG or even use the clear skin.
Exactly. Also,
several treatments for that
could really
Fantastic.
help. Yeah. So I think we've got time for one more combination, which is also, I found, a very interesting and unique combination, which is the erbium YAG and the DIVL or DISR.
Exactly. So probably less well known, less obvious, but together they can again up your results to the next level. Because these are both work on the superficial layers of the skin, I would probably recommend separating the sessions, separating the treatments.
Yeah,
for these.
I agree. I think it's another interesting option for fractional ablation and non-ablative treatment. And the result here is, I mean, absolutely amazing. Fantastic to see.
Was this our winner, Nama?
I think this is our winner, and so deservingly, because it must have been life-changing for this patient.
Absolutely.
This change in the skin.
5 sessions. So DIVL, I think, for 5 sessions, and then they came in
Afterwards
at the end
did the erbium YAG.
with the erbium YAG, and yeah, this was
incredible.
we can see why.
Yeah. So thank you for sending that in. We learned so much from this. Before we move on to our live Q&A session, I would just like to mention that there are other applicators that we haven't had time to mention here. For example, our beloved NIR or NIR, which so many people love. It's such a nice treatment. It's so comfy and warm and soothing. And you can add the NIR onto any one of our applicators. So you can add it onto the Clear Lift, you can add it onto the Clear Skin, or you can add it onto the Clear Lift and Clear Skin
three
combination.
applicators in one session.
Exactly.
Yep.
So I think that's a really good applicator for kind of like an add-on for more of a tightening, glow, Cinderella effect, or the catwalk treatment, as I like to refer to it as. So that's another amazing applicator that you can use. And I think the most important thing, and we mentioned this in the beginning, is to know what works and how.
Exactly, because I mean, ask yourself a question: what am I targeting here? You know, even what chromophore am I targeting? Where is it on the skin? Is it superficial? Is it deep? And if you have all that, if you know all that, and you're mindful of that, and even the skin laser interaction, the skin energy interaction there, am I ablating? Am I photothermolysis? Then again, you'll intuitively know what to combine and when. And if you don't, I say play it safe and separate your treatments.
Yeah, I agree. And I think if you prefer to separate your treatments, as you said, you can kind of build up a treatment program. So it doesn't have to be all in the same session. It could be a 3-month program, and then do some together, some Airbnb YAG in addition, NIR one day. You can really build up a complete program, a long-term program, if you don't want to do them in the same session. So
the holistic approach.
The holistic approach. I agree. So we do have some questions coming in, but I would just like to thank you all again for sending in these amazing results. On the screen here, you can see all of our winners and the runner-ups. But we got so much information from all of you.
We did. We learned a lot.
So much. And as we mentioned before, we will be releasing a protocol, a clinical presentation.
All the details, even more combinations, more photos than we showed today. That will all be in a clinical presentation of Harmony combinations coming out soon.
So let's move on to some questions,
from
our audience. Thank you all so much for joining us. We have a question from Spain. And this is an interesting one. What is the best protocol for summer? What would you recommend?
Okay, so we're lucky actually with the Harmony that we do have a lot of non-ablative treatments, meaning that we can go gentle and we can do them in the summer. And I would say, for me personally, I would say that one of my favorites for the summer is a Clear Lift, Clear Skin option.
Good point.
I think that's a gentle treatment. Obviously, you wouldn't want to do that on freshly tanned skin, but it's something that can be done in the summer with very little to no downtime. Of course, always high protection sunscreen before and afterwards. That should be a given for all of us. But it could be done in the summer.
I think that's a really great combination. As you know, I love the Airbnb YAG, but I think it's probably less recommended to do in the summer because of the resurfacing, because you're exposing the skin more than with the other combinations.
More downtime.
But I would like to add something on, challenge you with your combination and add the NIR to that.
Really?
I think that would be my favorite summer treatment.
Okay, fantastic.
Yeah. We've got another question by coming in from Bulgaria. What is your favorite Harmony combination?
That's a good one. Okay, you go first. And
okay.
I'm going to think about that.
What do you think it is? I think you already know.
Airbnb YAG.
Yeah, I think I do the Airbnb YAG either with a Clear Skin or Clear Lift. I just love how the Airbnb YAG, once you've done it, your skin just glows. So when you do that sort of resurfacing, it's amazing. When you just do that resurfacing and then add on to that, do a deeper treatment, let's say the Clear Skin, for more deeper tightening, and you can really see the lifting, the texture with the Clear Skin is so amazing that I think the Airbnb YAG and Clear Skin would be my favorite.
Okay, so I think mine, I would probably say Clear Skin Pro, Clear Skin, both of them. I've seen great results with that, like you said, texture, remodeling, fine lines, wrinkles.
And no downtime.
And no downtime. Almost a lunchtime procedure. I would probably combine that with Clear Lift, kind of bestseller.
I think that's a really go-to. It's such an easy combination. It's not a painful treatment. There's no downtime.
And you can kind of accumulate it. The more you do, the better. And again, with the masks now. So covering half our face right now, which we all have to do, you know, unfortunately is not the great environment for our skin. And this is something when you take the mask off, you can use that combination.
It's a really good
to rejuvenate
combination
yeah.
for times like we're living in at the
Exactly.
moment. Well, thank you all for joining us. I had a great time.
We had fun. I enjoyed it.
Thank you all for participating in our competition. And I'm sure there'll be more events coming up soon, so stay tuned and see you again soon.
Thank you. Bye.